Doctors, scientists, and medical experts are saying there's some hope and good news for Assam, that the COVID numbers will reach its peak very soon. And by the end of May and June, the numbers will reduce. They are also saying that there may not be a third wave and that there are no double mutants and triple mutants in the population. It's only an Indian variant. And they're saying that we can overcome the situation in the next 2 months. But this message comes with a warning that if we are not careful and if we do not take the precautions, then the disease could transmit and we could be facing a crisis again. We welcome you to this edition of the Doctor Speak at G+, where we talk to doctors, medical experts, and scientists to tell us about the present situation. So we have with us Dr. Biswajit Barkakoty. He is a scientist E at the Indian Council for Medical Research in Dibrugrah, and he's also the nodal officer of the regional level virus research and diagnostic laboratory. He's the man who's in the thick of things, who's been actually looking at the data that's been collected from the different states in the region insofar as the COVID-19 virus is concerned. And he will tell us about what the virus is all about, the double mutant, where are we going forward, how does the situation look like, and in the months ahead, what should we do, how afraid or how concerned should we be, and what are the things to look forward to. Dr. Barkakoty, thank you so much for giving your time, and we are looking forward to hearing from you. And just to also just ask you this question, insofar as the virus is concerned, please tell us, what is the virus and where are we now?
Good evening to you. And as you know, we are in a tough situation. India is in a very tough situation, and this pandemic has caused havoc around the world since last over a year, since last 2019 December when it was first detected in Wuhan. So India is reeling under the second wave since February this year. So what we have seen is that the second wave, how it was not predicted. You remember the Spanish flu, there was a second wave 100 years back, second wave, and that was more devastating. It is not that we have not predicted, we were anticipating the second wave. And that is why serosurveys were conducted by ICMR across India. So by December, and we had a serosurvey across probably at around 80 districts across India, and that came out to be around 22% seroprevalence till December. That means 22% of the population got infected by December 2020. So that gave us an idea that people are not necessarily immune. Large section, more than almost 80% are still susceptible to the pandemic. And then there was a risk that if mutation comes, the R0 value of the virus will change, and then the herd immunity level will change. If it was a 50% immunity, a herd immunity assay at 50%, it will go to 60 or 70% if the R0 value changes to a higher level of 2.5 to 3 or 3.5. So there was always a risk of mutation that may change the herd immunity level. So that was predicted, and that is why all those serosurvey studies are conducted across the India to know. But only thing is that because they were monitoring, and in the month of January, February, there were a lot of cases actually in Maharashtra, actually, and that mutation, that what we call double mutation, actually don't call, it's a misnomer. Double mutation is a misnomer. And it is a coronavirus is a variant now, a variant of concern now declared by WHO. So it is actually a lineage of B1.61.7, 617, actually 0.2. That is a variant of concern. So it has more than 15 mutations actually from the reference strain. In fact, 22 mutations.
22
but 15
mutations.
Yes, 15 important mutations are there. So it is not a double mutant or a triple mutant or like that. So these are all misnomers in the media actually. So what we have is that there are some important 2 mutations in the RBD domain, what we call the receptor binding domain, where the virus spike protein binds with your ACE2 receptor, that is the host receptor where it enters, through which it enters the host cell. So they are too important. So if those mutations occurs and they bind more tightly and their transmissibility increases. So the UK variant that is called the B1.1.7 is also has around 80% more transmissibility than the earlier strain, that is the Z clade. So now the classification at the B lineage, what we call B1.617, that is the Indian variant, what we call the Indian variant. It has important mutation and it may, that is the antibodies that are produced by vaccine or by natural infection, by the last infection that we had in the first wave, they may not be cleared as quickly as possible. Means there may be a little bit delay in clearing by the neutralizing antibodies may not work 100% efficiently as it would have worked. So in fact, we were getting a lot of asymptomatic cases. Those asymptomatic cases may be due to the infection that already people that were infected last year. So we are investigating all those things also.
So just interjecting. So just you talking about the Indian variant, just to make it clear for our viewers that it's not a double mutant, it's not a triple mutant. These are coinages that have come in the media. There are 22 mutations, and therefore it is called the Indian variant.
Yeah, it is. Till now, we have not found it is to be more virulent. Actually, what the death rate is showing as that, in fact, last year we had a death rate of a 1.4% case fatality rate. Yeah, and now this strain from January to May, we have around, most probably around 1 lakh death. Actually, by December last year, by the end of December, we have around 1.5 lakhs deaths in the country and around 1 crore cases, 1 point something cases, 1 crore or 5 lakhs or something like cases as far as I remember. So it comes around 1.4% case fatality rate. So what we have now is from January to May today, we have around 1 lakh death. That is today it is around 2.5 lakhs death total confirmed death. That means around 1 lakh new deaths has occurred in 2021, right. And we have around almost 1.26 lakhs cases, new cases. So what you see is less than 1%. In fact, lower than the last year.
Oh, it's lower than last year. I see.
Yes,
and
it is lower.
Yeah. And can I just also sort of quickly, I don't want to interject, but just if you could also tell us about the situation of the Northeast in terms of the numbers. It is lesser than last year, or is it more than last year? And where are we insofar as the region is concerned?
See, last year in the wave, Assam, I'll talk about Assam as far as we have around 1,100 deaths due to COVID, and this is very unfortunate. But Assam was fighting. And it was, I mean, it's one of the best state in the country who could tackle the first wave. And it has limited its number of deaths. And there were a lot of effort by the health authorities, even giving free drugs, therapy, remdesivir free to the patients and all those things. And those has not happened to the other parts of the country. I don't know what is happening in the rest of the country. I don't say it was managed 100% well, but the death was limited up to 1,100 deaths, and we had around 216,000 cases last year in Assam. So the fatality rate, case fatality rate was around 0.5% or something like that, 0.4 or 0.5, something like that. So it was quite low. Now what is happening with, we have around 650 deaths this year, almost. Now we have around 1,700 something, 53 or something till yesterday. So around 650 deaths, and we have around 82,000 cases in the last few months in 2021. So in Assam, that gives us a case fatality rate of around 0.8%, little bit more than the earlier one. So, but
there is a rise. There's an increase. You're saying there is an increase.
There is a little bit increase in cases, but it is lower than the Indian average. Still now, it is lower than the Indian average.
The data from the Northeast, what in terms of the data that you're getting from all the states in the Northeast, is it very alarming? So because vaccines, are again short, we are not being able to really vaccinate the entire population. People are getting frustrated because they're not able to get any schedules. Guwahati yesterday, we had a lot of people complaining. So in terms of the data that you're getting from the Northeast at your lab in the ICMR, is it very concerning? What do you have to say?
It is concerning because the transmissibility this time is much higher than the last year. Actually, when what we had seen in last year is If a person is infected, the context, a lot of contexts were negative. Even if the husband was positive, he was sharing with his wife or spouse, they were negative sometimes. And this time, all the family members are positive. So it is spreading fast, and the viral load is higher. And so that's why it is rapidly increasing. The curve that when you see last time it was spread over 10 months, whereas this 1 lakh death occurred that is over hardly 2 months. This occurred hardly over 2 months. So that is the situation that is creating panic.
And is it, are we seeing a peak in the Northeast, in let's say Assam, for example, or the other states? Will we see a peak that will happen at a certain time, let's say 2 months from now, or are we already seeing the peak now?
We are in a sort of a starting to reach the plateau. I hope so. Within next 1 week to 2 weeks, we'll be reaching the plateau. And by the end of May, we will be having a downward trend. Downward trend we should have, because that is what the epidemiological curves are, how the pandemic or an epidemic moves. Because when a lot of people gets infected, the virus doesn't get uneven person to infect, and slowly the speed of the virus infection decreases. So by June, maybe these are the critical months, May and June. By June, we should be having a downward trend. But you never know the virus, if more mutations comes and if the transmissibility again increases, if the R0 value again changes, then it may persist for a much longer time.
And Doctor, sorry, because you're saying it may persist for a longer time. Does that indicate there will be a third wave? Because we've heard the Principal Secretary Health and also other medical experts warning of a third wave. Are we also seeing a third wave in the eastern part of India, northeast?
As far we are concerned, we don't think so there will be a third wave, because as per our estimate, around till now, around 40 to 42% of the Indians are already infected. Because when one case is detected, there are suppose now we have around 2.3, 2 crores 30 lakhs people infected. But that it does not is the accurate figure. That is being, there are around 20 to 25 silent cases from each case detected. So you will have around more than 60 crores already infected with COVID-19. This is based on our study and based on other studies of serosurveillance study, where you get more antibody than those cases in the community. So,
Doctor, are we able to say how many, what will be the size of the population in the Northeast that will be infected? Like you've just said now, 6 crore, maybe you're talking about the nation. I mean, a nationwide picture.
Yes, about the, suppose we have a 4.5 crores population of the Northeast. If I'm wrong, I don't know. That is the estimate of the population of Northeast. So with that population, we according to our sero survey last year, we did in only one district, that is a cluster sampling size, PPS sampling, and that was pretty accurate. And we got a rural of around 40% already sero prevalence. So if that is true for all the districts, because there will be spots where there will be less than 5% or 10%. So you never know where. But as a whole, if we calculate by the death rate also, what is the number of deaths? Because as I have told you, you can multiply the death into 2,500 or 2,200, and you get the exact number of people infected. Suppose you have 1,000 deaths in a state, and if you multiply it into by 2,500, you will get the exact number of infected people. That is infection fatality rate. So with that percentage, I don't know, it is around 80 to 90 lakhs people infected in Assam till now, whatever we have seen, 80 to 90 lakhs people. So there is a long way to go in Assam. So there will be spots where there will be more in urban areas, the seroprevalence will be high, and in some rural areas, there will be low. And we need more data from seroprevalence data that we can arrive at what is the percentage of people that will be infected. Right. But mainly is that it is estimated around 25 to 30% people of the Northeast till now will be having immunity. So that is what we are expecting.
20 to 30%. Okay, that's at least, I mean, that's some sort of a figure to at least look at. Doctor, you've given us so much time and explained this entire thing to us about how the virus mutated. It is not double or triple mutant. It's the Indian variant, and therefore it transmits that much more faster in the population. So people have to be careful. And I think the basic guidelines that are being given out by medical experts, I think you also would agree and tell us the same thing, that the mask and sanitization, physical distance, all that is a must.
Must, that is must. And one more thing, for increasing your, positioning while you are sleeping, a COVID patient. So there is a recommendation that you do a proning for around 2 hours. Proning means sleeping on the tummy, on the tummy, so that aeration of the lungs occurs quite good. So these are given in the government guidelines also, different posture where you are have to sleep during, and so that your aeration of the lungs is good and perfusion of oxygen is good, and ultimately we hope we can defeat this virus maybe in another 2 months. We hope so.
Right, Doctor.
Thank you so much.
Thank you. You've said we will defeat the virus. We hope to defeat the virus in the next 2 months. At least that gives us at least hope and gives us positive hope. And with people like you working and relentlessly working to find a solution together with the rest of the world, we can but hope for the best. Thank you so much, Doctor, for your time.
Thank you so much. Thank you.